Now let's discuss approach to a patient with back pain. So low back pain. Basically, back pain is an extremely common human phenomenon. So almost 80% of people in modern society will experience back pain. Out of these 80% people, 70% of them it subsides within a month. And again, in these 70%, another 70% of these people, the pain recurs again. So causes, they can be specific or non-specific. So among non-specific causes, you can have postural causes and non-specific work-related trauma. So among the specific causes, you have sinister causes. Okay, the first thing to do in a case with back pain is to rule out sinister causes. So you can remember it as 3T's. So tumor, trauma, and TB. Okay, so specific causes, you can have congenital causes like spina bifida or lumbar scoliosis, spondylosis, spondylolisthesis, transitional vertebra, something. Traumatic causes again sprain, strain, fractures, and disc prolapse. Inflammatory causes again tuberculosis, and inflammation is itis, right? So ankylosing spondylitis, spondyloarthropathies. Degenerative again old age, osteoarthritis, neoplastic, so benign osteoid osteoma commonly. Malignant primary is most commonly multiple myeloma, and also you can have secondaries. Metabolic causes, you can have osteoporosis, osteomalacia, and referred from viscera, you can have genitourinary and gynecological diseases, and also functional back pain. Okay. So basically, once you rule out sinister causes, then you can go on to a systematic approach. So history. Back pain is uncommon in children. If it is present, it is an organic disease. In adolescents, mostly it is postural and traumatic, okay, ligament or sprain injury. Because they play sports, they can injure themselves. Again, in adults, spondyloarthropathies like SPAs and disc prolapses, they are common. So SPA-related back pain occurs across the age group from adolescence to early adulthood. In elderly persons, it is degenerative, mostly osteoporosis or arthritis or metastatic bone disease. They are the causes. So back pain is more common in women, especially after they've had pregnancy. So this is because of excessive weight, lack of exercise, nutritional deficiencies, so osteomalacia, etc. In men, back pain is mostly due to obesity and bad posture. Okay, occupational history. So role of occupation in back pain, it may not be understood by the patient, but it is present. It is common in people who remain sedentary most of the time. So surgeons, dentists, computer professionals, etc. So past history, again, it is significant. Features of pain. So think about the location of the pain. So you can have pain in the lower, middle, and upper spine. So disc prolapse and degenerative spondylitis, it occurs in the lower spine. Infection and trauma in the dorsal lumbar spine. Postural back pain because you're stooping or something, you can have it in the upper back. Onset. So there's a history of significant trauma immediately preceding an episode of back pain often, and it may indicate a traumatic pathology. At times, the trauma happens to be a precipitating factor, and there may be an underlying non-traumatic pathology. Think about the localization of the pain. So pain arising from a tendon or muscle injury is localized, whereas that originating from deeper structures is diffuse. Often it is referred to the lower limbs, so sciatica, with associated neurological signs like numbness and tingling, so pertaining to a particular dermatome. This is a pointer to nerve root entrapment. Then think about the progress of the pain. Okay, so especially in traumatic conditions, so you are hitting somebody, so it is fractured. So as it heals, the pain will reduce, and it is maximum at onset. It will reduce as it heals. So that is traumatic progression. Okay. Next, back pain due to disc prolapse. It often has periods of remissions and exacerbations. So here you can see disc prolapse, there is remission, exacerbation. Okay. And then in osteoarthritis, there is remission and exacerbation, but it is more frequent than in disc prolapse. And tumor or inflammation, see, as the size increases, it keeps compressing, the pain also increases. So a tumor or inflammation, it increases like this. Then aggravating relieving factors. Most back pains are worsened by activity and relieved with rest. All back pains which have inflammatory component are worse in the morning, and they get better with activities. As the blood flow increases, all the inflammatory mediators are washed out. Example, spondyloarthropathies. And those of mechanical nature also, they become worse after a period of activity and get better with rest. For example, postural. Severe back pain at night that responds to a tablet of aspirin may typically be due to a benign bone tumor. And so night pain, you are giving aspirin, it is reducing, so it is bone tumor probably. And back pain with radiation initiated on walking or standing for a long time, relieved by rest, is a feature of spinal stenosis. Okay. An increase in pain during menstruation may indicate a gynecological pathology. Look at the associated symptoms as well. So stiffness is prominent in pain due to spondyloarthritis. It is more early in the morning. So pain in other joints, okay, especially in spondyloarthropathies, there's a history of pain and swelling of few more joints, or there can be enthesopathy, okay, at the attachment of tendon to bone, you can have pain. You can have neurological symptoms like paresthesia, numbness, weakness, etc. And then you can have extraskeletal symptoms, gynecological or urogenital complaints. Mental status also, you need to rule out hysteria, malingering, etc. Okay, so then go on to a physical examination. Standing posture, look at the position. Okay, so normally when a person stands erect, the center of the occiput is in line with the natal cleft. Okay, so the two shoulders are at the same level. Okay, and the lumbar hollows are symmetrical and the pelvis is square. Okay, so in a case with back pain, look for scoliosis. Okay, like this, kyphosis. Okay, so convexity at the back. Okay, and lordosis, etc. Okay, any pelvic tilt. Okay, and any forward flexion of the torso on the lower limbs. So look at postural deformities. Then look at spasm. So muscle spasm may be present in acute back pain. It can be discerned by the prominence of the paravertebral muscles at rest, which stand out on the slightest movement. Then tenderness. Localized tenderness may indicate a ligament or muscle tear. There may be trigger points or tender nodules in case of fibrositic nodules. Then pain originating from the sacroiliac joint may have tenderness localized to the posterior superior iliac spine. Then tenderness localized to dorsal-lumbar spine is an important physical finding as to the common site of sinister etiologies. So dorsal-lumbar spine, common site of METs, etc. Swelling. So cold abscess may be present, indicating tuberculosis as the cause, and the range of movement. There is limitation of movement in organic diseases of the spine. Then lying down position. See, in supine position, the following observations can be made. So basically, you can do a straight leg raising test to detect nerve root compression, neurological examination to localize the spine pathology, peripheral pulses to detect a vascular cause of low back pain, which could be due to vascular claudication. The skin temperature may be lower. Adjacent joints, so again, pain may originate from hip joint or sacroiliac joints, and again, abdominal, rectal, or pervaginal examination. So see here, this is bending at the hip, and this is bending at the spine and the hip. Okay, bending forwards. Then investigations. See, if the pain is of less than 3 weeks duration, don't get an x-ray. If it is more than 3 weeks duration, you need to get an x-ray, and along with clinical examination. So radiological examination, routine x-rays of AP and lateral view of lumbosacral spine and pelvis should be done in all cases. So again, you can diagnose a varying number of diseases, and MRI scan is a go-to modality, and blood investigation should be carried out if you are suspecting infection, malignancy, metabolic disorders, etc. And electromyography if nerve root compression is a possibility. Principles of treatment: rest. Okay, so hard bed is allowed, and a gradual mobilization using aids like brace is used. And then drugs, analgesic, anti-inflammatory drugs. So in cases with a stiff spine, you can give muscle relaxants. Physiotherapy, this consists of heat therapy, shortwave diathermy, packs, heat packs, ultrasonic waves, etc. Traction, it is given to a person with back pain with a lot of muscle spasm. Use of corset, so it can be used as a temporary measure in treating acute back pain and back pain due to lumbar spondylosis, etc. You use a corset. And education, so patients must be taught what they can do to alleviate the pain, so especially educate the patient. Okay, major causes of back pain. So congenital disorders, spina bifida. This and other minor congenital abnormalities of the spine, they're present in about half the population. So so other pathological conditions should be ruled out before trying to diagnose this. Transitional vertebra, so it is one at the junction of two segments of the spine. So characteristics of both segments is present in one vertebra. It is common in the lumbosacral region, either as lumbarization or sacralization. So S1 becoming L6 or L5 fused with the sacrum. Then traumatic disorders. So it could be back strain. So this often arises from trauma sustained in daily routine activities rather than from a definite injury. So athletes, tall and thin people, jobs requiring standing for long hours, and those working in bad postures. Compression fractures. These fractures occur in the thoracolumbar region. So treatment depends on the severity of compression. Inflammatory disorders. So you can have tuberculosis. Spinal tuberculosis is a common cause of persistent back pain. Okay. Ankylosing spondylitis. So young male with back pain and stiffness symptoms are worst in the morning, relieved on walking about, means it is inflammation because of increased blood flow. When he's walking about, the inflammatory mediators are being washed out. Young male back pain, stiffness. So ankylosing spondylitis. Then degenerative disorders you can think of: osteoarthritis, prolapsed disc, or spinal stenosis. So there is narrowing of the spinal canal. It may occur in whole of the lumbar spine, like a chondroplasia, or in a segment of the spine. So stenosis may be in all parts of the canal or only in the lateral part. The lateral is called root canal stenosis. So it may give rise to pressure or tension on the nerves of the cauda equina or lumbar nerve roots. So patient will complain of pain radiating down the lower limbs on walking some distance. If you take rest, it will be normal. The other reason for claudication is vascular compromise to the limb. So basically, in vascular claudication, look at peripheral pulses. They will be absent. Skin temperature, it might be reduced in the lower limb. See, on standing, there is no effect, but on standing, the patient has to rest in neurogenic claudication. He has to rest on walking, okay? And then cycling, this produces pain, okay? And no effect in neurogenic claudication. Cycling, it is continuous activity, right? So you are using up most of the blood, so vascular claudication. Pain at rest is present in vascular. Pain at rest is not absent in neurogenic, okay? You have to walk or stand. So then pain is relieved by stopping the activity and pain is relieved by stooping forwards here. Then tumors, both benign and malignant tumors, occur in the spine and the spinal canal. So tumors of the spinal canal, usually benign, are classified as extradural or intradural. Again, intradural, you can have intramedullary or extramedullary. So diagnose it on myelogram or CT scan. So usually they are secondaries from other cases. So benign tumors, you can have an osteoid osteomite. It's the most common benign tumor of the spine. This causes severe back pain, especially at night, and it is relieved by aspirin. It is usually a pea-sized tumor found in the pedicle or the lamina. Hemangioma also occurs in the vertebral body. Meningioma is a common intradural extramedullary tumor. Then malignant tumors, multiple myeloma is the most common primary malignancy. Metastatic deposits are also common. And other causes, you can have metabolic disorders like osteoporosis, osteomalacia, spondylosis, spondylolisthesis, facet arthropathy, and subtle arthritis, okay? And functional back pain. See, mostly patients, they are anxious. They have myriads of pains and aches all over the body. They visit multiple doctors, all that. You think of functional back pain. So what you do is called Manson's test. So you ask the patient to pinpoint the location of the back pain and you continue with your examination and divert the patient's attention from the back. Then after some time, again tell the patient to point out at the pain. He will localize it to a different region, okay? So he might have forgotten which site he pointed to earlier. So that is Manson's test. Then you also can find overreaction by the patient during the physical examination. Non-dermatomal pain, so physical signs are inconsistent with the specific routes. So approach to a patient with back pain. So first establish whether the problem is acute or chronic, okay? If it's an acute pain, acute is 3 to 6 months, or chronic is longer than 6 months. So if it is an acute pain, whether it is related to a definite episode of trauma or if it is spontaneous at onset, okay? So investigations, you can do plain x-rays, you can find out congenital malformations like fused vertebra, hemivertebra, spondylolisthesis. You can also find scoliosis, degenerative spine disease, all that. MRI is the investigation of choice in a diagnosis of spinal disorders. So you can find out all soft tissue pathologies as well, like abscess, synovial tumors, neural tumors, etc. Okay. And then blood tests are also required based on what you suspect. And sciatica, it is a symptom and not a diagnosis. It is a pain radiating down the back of the thigh and the calf. So degenerative arthritis and disc prolapse are the common causes. You can also have other causes like inflammatory causes like sciatic neuritis or arachnoiditis. Nerve root compression, so compression by a disc or tumor or tuberculosis. Compression in the vertebral canal. Compression in the intervertebral foramen due to root canal stenosis because of osteoarthritis, spondylolisthesis, something like that. Compression in the buttock or pelvis by an abscess tumor or hematoma. So this is a flowchart. Look at first whether the pain is acute or chronic. Okay, acute is less than 3 months, chronic is more than 3 months. So see, if there is a history of trauma, it could be due to a back strain. Okay, so again, soft tissue, there could be a strain, sprain, etc. There's a history of trauma, but X-ray will be normal. But in acute disc prolapse, the X-ray will still be normal. There is a radiation of pain. So acute and there is no radiation of pain. It is well localized tenderness. So X-ray is normal. Then think of back strain. Okay, if X-ray is normal but there is a radiation of pain, then it is acute disc prolapse. And there are root compression signs as well. SLRT is positive because it is an indication for nerve compression. Then fracture of vertebra, then X-ray, obviously you will see bony injury and localized tenderness. If there is no history of trauma and acute back pain, you can still think of acute disc prolapse, okay? And you can think of osteomyelitis associated systemic features, okay? So osteomyelitis, there are systemic features, you can find a cold abscess, high ESR, etc. Tumor, again, there is no history of tumor. It can be acute, rapidly progressing tumor. So there is a neurological deficit, local tenderness, and X-ray changes are present. If it is a chronic back pain, see whether it is improving with rest or improving with activity. So if it improves with activity, there is inflammation, which is, and the mediators are being washed out with activity when there is reactive vasodilation. So it is spondyloarthropathies. Okay, you will have associated large joints involvement. It is a young male. Okay, so heel pain is present, HLA-B27. Okay, and if it improves with rest, it is mechanical back pain. So if there are not many findings, it could be metabolic, it could be spinal stenosis, degenerative arthritis. If findings are present in chronic back pain, okay, it improves mechanical. So it could be chronic disc prolapse or spondylolisthesis or postural.